show. And what we'll do today is have a 20 to 25 minute briefing from me. Then we will stop, and depending on whether Jack is showing us his screen, we will show you what Jack has drawn. And then we'll go into the discussion session, and I will ask Catherine to help us through the discussion session. And then we will close, and as we close, I will invite Twee to close us. Now today, unusually, I do need to get away on time. I've got something I've got to do which is time sensitive, so don't be surprised if you see me departing the event a little sharpish, and I say that, and I will try to leave the line open when I go. So let me go into the details, and I just want to start off by saying that in the last 2 weeks I've had a fairly central role, along with quite a lot of other people from our organisation who are on this call, including Twee and Guyan and John Atkinson, Florence Lusbens. We have been pretty heavily involved in the first ever United Nations Summit on Food Systems. That took place virtually on the 23rd, and then it was extended to the 24th of September. And I'd quite like to share with you some of what went on in that summit, because just in a very, very short summary, and I'll come to this later, this summit consisted of more than 140 statements from governments, many from the heads of state, the presidents of countries, and almost all of these statements focused on the interplay between COVID-19 and food. And we were very much brought to recognise that the links between COVID and food, the links between climate and food, the links between conflict and food are all really very, very important when thinking about our collective future. And so we can't look at food in isolation from other areas. And I'll talk more about that in a second. Also, since we last met, I've been participating in events around equity and COVID, and also events around access to vaccines, and I'll talk a bit about that as well. I'm going to try to come to two questions that have come into the LinkedIn group, one from Colin Christmas, I think, on ISO, and one from David Harron on expanding vaccine distribution. Try and do that before we break. Very good, and please don't hesitate if you've joined on a computer to put comments and questions in the chat, and if you would rather do it some other way, please make sure you get a message, an email or a text to Catherine or to Twee. Try not to text me because I won't be able to scan through my phone. Then I've got, just want to say that Ad Spikers, I just saw him on the thing, and I'm looking to see whether you're still here, Ad. Can't see you. Oh, yeah, you are. Ad Spikers has very interestingly produced a note on COVID and food systems, and I'm very grateful to Ad for doing it, and just want to say that Twee has made sure that Ad's note is visible on the 4SD website alongside the other narratives that have been developed. We've spotlighted Ad Spiker's article, which is very much drawing on his experience as a specialist in food systems. Ad, thank you very much indeed for sharing it with us. It was really great, and Twee's put the link to Ad's article in the chat. And I want to welcome you all, but I'm now feeling that I want to get going, so I'll come back and talk a little bit to some of you individually and just greet you at half time. So I thought now it's a really important time to share with you what's going on with COVID-19 as we look around the world and see the epidemiological pattern. And I just want to ask the question, really, are we reaching the end of the pandemic? And are we at a point where we can start saying that actually it's getting better and the end is in sight? We got to this point with the Ebola virus outbreak in West Africa in about March or April 2015, but it's taken an awful lot of months since then to reach the point of Ebola 0 in West Africa. It really was quite tricky, and I want to keep stressing that even when you think you can see the end is in sight, it takes time to get there. So that is the sort of exam question for today: is the end in sight? And here are my reflections to that. Well, it's still, according to the data reaching the World Health Organization, quite a ferocious pandemic. In the last 24 hours, there were 353,000 new confirmed cases reported to WHO. 6,212 people lost their lives. And yes, that is about 4,000 less than the daily death toll at the height of the current peak, what is being described by some as the fourth peak of COVID cases, about a month and a half ago. So yes, the numbers are down, but they're absolutely not anywhere near zero. We're still in a very extreme situation, and I personally want to say to everybody that running with somewhere in the region of 350,000 new confirmed cases on the 27th of September and 6,000 deaths is not good. And I mean, the fact is that the day-to-day variation is huge. Like if we go either side of yesterday's numbers, the numbers coming in for the day after, for the 28th, are up, and I'm just not prepared to say that we're nicely coming down towards zero. I think we're still very much in a high space, and the cases are being reported from United States of America still, from the United Kingdom still, from Turkey, Russia, India, Brazil, Iran, Philippines, Malaysia and Germany. And just to give you a feel of it, you might have 100,000 cases reported in a day from USA, 35,000 cases reported from UK, and then 12,000 from Philippines, 12,000 from Malaysia, 12,000 from Germany. Quite a wide spread. But the key thing, of course, as I've said before, is that the numbers of deaths are not neatly going along parallel with the cases, with the deaths coming about 2 to 3 weeks after the cases. No way. Now there seems to be a delinkage of cases and deaths, and so the US deaths numbers are still really high, but they're nothing like as the same intensity as the US deaths numbers are still high, but they're nothing like as high as the case numbers are. And the deaths are high also in Russia, Brazil, Mexico, Philippines, India, Iran, Lesotho and Turkey, but relatively low in the UK, which is one of the countries that has managed to delink cases from deaths thanks to the pretty high level of immunisation. So what's going on in the US? Why are the numbers really still very, very high? And the answer is, despite having a super successful early rollout of immunisations, there is now a very serious situation in the US with, depends on how exactly it's calculated, but somewhere in the region of 30% of the adult population not only not vaccinated, but proving to be really hard to vaccinate. The level of vaccine resistance, I don't like calling it hesitancy, in the US is really high. And there's similarly high levels of vaccine resistance in France. And I mean, even when you get one of these vaccine resistors getting really ill and then making an appeal from their hospital bed on something like Fox News in the US, even when they start saying, come on everybody, I was wrong, get vaccinated, that doesn't have much of an impact on that community of people who are the resistors. There is much more to this resistance than simply people don't have the information, or people need to be persuaded a bit longer and stronger, and then they'll change. No, these are quite entrenched beliefs now, and there are many people here and many people in the World Health Organization and others who are getting really quite sophisticated in their understanding of why there are such large numbers of people in particular European settings and in US who do not want to get vaccinated. And there are big differences. You do have many settings with much higher levels of vaccine uptake, and that in turn is a very good sign. I'm going to talk about vaccines as we go into this brief. So the pandemic is still very much there. The pandemic is still a concern, but there is most definitely a spirit in many countries in the world that suggests that the problem is being dealt with and in some cases is over. And so, for example, in many parts of the US and in Europe, it's quite difficult for people to be wearing masks and not get ridiculed. It's quite difficult for people to insist on physical distancing and not get into trouble with their employers or others who have power over them. And there is a most definite sense of exhaustion among populations about really not so much that the pandemic is still here, but about the extraordinary mixture of messages that people are receiving, and all of you know that. Now, I want to pick on a number of features of COVID that I think we all need to be aware of. First is COVID is a disease that affects poor people much worse than it affects better off people. It's also a disease for which poor people are less easily able to prepare themselves than better off people. It's a disease that limits the capacity of poorer people to be able to earn enough money to feed themselves, because it dries up economic activity, but particularly the kinds of economic activity that provide employment for people in the informal economy or people on daily wages. And so just imagine this. You've got a disease that hits poor people much worse than it hits rich people. So what does it do? It very quickly increases the gulf between rich and poor. It increases the gulf economically because it makes it harder for poor people to earn enough money, so poor people get poorer. But it also increases the gulf of trust. There's plenty of evidence now that poor people, as a result of COVID, are finding it much harder to trust their government. And it also increases the gap because poor people historically have less good access to services. And so, almost by definition, their needs are greater, but their access is less. I put it to you that we're in the midst of a period when the gaps between the well-off and the less well-off in our world are increasing very rapidly indeed. But it's very difficult to get an instantaneous assessment of that. Usually the numbers come through a year or 2 years after a big increase in inequity. So I'm going to ask you to be thinking a little bit during the next 2 weeks about whether you agree with my hypothesis that the gaps are increasing, and then whether you've got any evidence that you can draw on to suggest to you that this is happening. And I'll give you some clues. Still, the COVID-related mortality rates among non-Caucasian people in Western Europe and in the US are much, much higher than they are among Caucasians, and that is thought almost always to be associated with their economic deprivation. Now, I also have a question to you. If a disease is associated with increasing inequity, then it makes sense that the public health decision should be to deliberately focus on the needs and interests of poorer people in order to protect them. So you have special programs to support poor people, especially if they're asked to isolate when they're sick. Or you have special initiatives to enable poor people who are not able to access the necessary cash for food, so they can get extra access to food. But right now, in most European countries, just around the beginning of October 2021, the special supplements that have been provided to those who are particularly poor to help them if they're affected by COVID, these are being stopped. So the UK furlough scheme is being stopped. Some of the US protection mechanisms are being stopped. So there is a direct association between the political priorities of government and the prospects of poor people being helped. A government that is pro-poor, a government that bases its decision making on the needs of poor, will most likely have a different reaction to the impact of COVID on society to a government that's primarily focused on the well-being of the better off. And I think we're seeing this in the different positions taken by states throughout the US, with some of the southern states actually behaving, it appears, in a way that seems designed not to protect poor people who are particularly affected by COVID. I want to leave that part of my remarks by just saying that I think every single one of us needs to be asking ourselves, given that COVID is a disease of poor people, what ought national governments, local governments, businesses and community organisations do to protect poor people given their increased risks? I want to take this one stage further and to focus on the Food Systems Summit of a week ago. I heard President after Prime Minister after Foreign Minister from these 140 countries that were giving statements say very clearly that COVID pandemic is a wake-up call. They use the present tense because many of the countries are still affected by it. They don't talk about recovery or it's finished. No, it's still here. And they say that in the midst of COVID, especially because they've asked people to stay at home, like Uganda with its lockdown, quite a long one, in this period, what's happening is that people have got less cash. And because they've got less cash, they're less easily able to get food. They're getting hungry. And so we've got masses of data now to suggest that the numbers of hungry have increased by 50%, 60%, 70%, if in different areas, even 100%. And that this is impacting on children, impacting on women, impacting on men, impacting on school attendees. And essentially, it's taking us back towards where we were on the food in the food crisis of 2008, when the world reached more than 1 billion people hungry, 1/7 of the world population. Well, we're not there yet, but we're moving towards that. Now, in addition, COVID has led to real anxiety in multiple governments about their food supply chains. Throughout the islands of the Pacific, the islands of the Indian Ocean, islands of the Caribbean, landlocked nations in Central Asia and in Africa. We're getting the same message. That because of COVID, they got worried about their supply lines. They got worried about food security. In preparation for the summit, more than 145 countries have undertaken food systems dialogues, multi-stakeholder dialogues, to look at their future that they want of their food systems. And in more than 104 countries, this multi-stakeholder effort has led to the development of pathways, strategic pathways that will be designed to take the country to the kind of food system it needs in future. It's a huge participatory exercise, and taken together with all the different kinds of dialogues that have been organised in the past 18 months, there's about 105,000, just counting, of people who've been involved in this process. So here we have, the first time ever, the world has looked at food as a system. First time ever that there's been multiple countries launching multi-stakeholder dialogues on how to get to the future. And the first time ever that we've had the simultaneous production of so many strategic pathways, including from the United States, including from Russia, including from Brazil, including from South Africa, including from China. I mean, this has been a very important exercise. So when they came to the summit, these heads of state and government didn't just stand up and talk whatever they felt like talking. They came, most of them, to speak on behalf of their nation, drawing on the results of these multi-stakeholder dialogues. And the clamour related to COVID was huge. In summary, it was: we don't like depending on food imports. We've learnt through COVID that it's a very precarious situation to be in. We've learnt through COVID that you just need anxiety about a pandemic and the shipping lines all break and imports break. We've also learnt through COVID that our economies are precarious. Our whole tourism sector is broken. What we decided to do, say these heads of government, shorten our supply chains, increase local production, make it good quality and nutritious food, not the kind of junk that we tend to get through our import pathways. We want to be able to use this as a way to improve the prosperity of our people. We want to be able to use it as a way to contribute to the environmental sustainability of our lands. We had this so much from the Pacific. It was a mobilisation of Pacific nations like I'd never seen before. And what's going to happen after the summit during the next 2 years is a huge amount of effort to look at aspects of food systems and say, how can we work together to make them better? How can we work together to ensure that they enable people to be healthy and well nourished and do not harm them? How can we work together to make sure that food systems regenerate nature, don't destroy the environment, contribute less carbon dioxide and methane into the atmosphere? How can we work together to make sure that we reduce the awful impoverishment that's going on in rural areas throughout the world? Rural poverty is on the increase. What can we do to tackle that? What can we do about the fact that 75% of the people who work in food systems are women, yet they're systematically underpaid and mistreated? And agricultural workers are some of the worst paid people in the world, doing some of the most horrible jobs that exist. And we know that more and more in Western Europe. There's a total shortage of agricultural labour right now, but it's particularly bad in the UK and in the US. So how are we going to deal with all these problems? Well, that's where the Food Summit has led to a real sense that transformation has got to happen. And it's led to a real sense that we've got to make this transformation such that in the face of future COVID-19 type shocks, in the face of continuing climate uncertainty, that there is greater resilience. And the particular decision from governments taken at the summit last week was, we're going to shorten our supply chains, increase local production, increase the quality of the food that we produce, and make ourselves more self-sufficient, even sovereign when it comes to food. I mean, that's hugely controversial. The food exporters, there are about 20 major food exporting countries, Argentina, Brazil and so on, do not like this. They don't like countries developing conditions for imports. And that's because that goes against the negotiations that have been agreed in the World Trade Organization. But you get the sense that COVID has led many governments to say, no, we're going to take control of our food and we're going to do it differently. So that's just one outcome from this food summit, but it's still reverberating, and we're going to hear much more about it, and I thought I'd just share that with you. Last point's just to say that vaccine inequity continues. It's a real issue. There's a lot of disinformation going around. There's a new line of narrative that's coming out, I don't know where from, that says there's no problem with supplies. The problem is just that developing countries can't absorb the vaccine that's available. Don't believe it. Don't believe it. Marion Hazelgrave, one of us, has been in touch with her friend Jotham Muzinguzi, who runs the Uganda medical store. Jotham travels out to the airport every day on the off chance that a few donated vials of vaccine will become available. Rarely does he know whether they've been kept under cold chain conditions. He has to take whatever is offered. But this Pfizer vaccine, some of which is coming, has to be kept at -60. The Moderna vaccine has to be kept at -25 or -30. It's incredibly difficult to run a vaccination program in a poor country with limited electricity, with a vaccine that has to be kept ultra cold, when you don't know what you're going to get each day. And you have difficulties then getting the vaccine out. It's just a totally unreasonable expectation of poor countries that they're able to run vaccination programs using crumbs in this way, when you look at the absolute enormity of the logistic operation that's been necessary, for example, in France or in the UK or in the US. So just do not accept it if anybody tells you that there's no case for getting vaccine to poor countries because they can't absorb it. That's just really an incorrect narrative, and it's been put round by people to justify the greed of rich nations. Please don't use, Jack, the word greed. It's being used to justify the desire of rich nations to try to get as much vaccine as possible into their stocks. And there's no justification for rich nations, as Britain's had to do, chucking away expired vaccine. So altogether, the vaccine situation is terrible. And in addition, we've got a situation where countries like the UK are saying, if you've been vaccinated, even with one of the vaccines that's been given a listing in the UK, but your vaccination was done in Africa or in Asia or in India, you won't count. It won't class as vaccinated. And that is really wrong. Really wrong. And then consider the problem of the person who's in Thailand, who's offered one of the Chinese vaccines because that's all that's available. But that same person wants to travel to the UK in some months' time and says, no, I better not have the Chinese vaccine. I better hope I can get vaccinated with the vaccine that's licensed in the UK. But then gets COVID in between and gets really sick or dies. I mean, that's the kind of stuff that's happening at the moment because of what I think is really brutal behaviour around vaccine certification, what some people call vaccine apartheid. And it's getting worse. So yes, in places the numbers are coming down. Jamaica, Japan, they're coming down. Guinea, West Africa, they're coming down. Thailand coming down. So it feels good. But I reckon it's going to go up again. It always does. And the situation on vaccines is particularly difficult. And the inequity problem is huge. So this is my briefing. I mean, I don't sugarcoat, okay? I don't think it's helpful. I tell you what I think is happening. And what matters now is that we talk about it. So let me go quickly to well, I'd like to go to Catherine to help us in this middle part, and Catherine also to take us to Jack.
I'm unmuting. Yes, I actually, it turns out that the Oxford English Dictionary gave us a new word for this. I have to go look for unmute while you're on Zoom calls. Jack, do you mind pinning your picture? Super. Do you want to give us a quick overview?
Yeah, hi everyone. I don't know if I can add anything particularly significant. Just to say it's hopeful that there is some global governmental will to adjust food systems to something slightly less kind of extractive and sustainable, and potentially pandemic inducing. But yeah, otherwise everything here is pretty much what David said. So yeah, no, I'll leave it to better minds than mine to contribute. But thank you. Thanks for having us here as always.
I'm going to argue about the better minds piece, since the drawing is a skill I do not have at all. So I would call yours a better mind indeed. But I do like the globe with the varying arrows and the travel and the virus moving around. I think that's particularly useful. I might cut and paste that into something that I need to use later. I think that's fantastic. Okay, David, we have a number of great questions. We have questions from Ad and from Christina and from Beat. I've sent them to you in the WhatsApp, and I think we are ready to go to the next phase if you are ready.
First of all, I want to say I don't think unmute's a good word. And it doesn't sound nice. So I've been playing around with anagrams of it. I like mutune, M-U-T-U-N-E. But I'm not sure how I would get people to test that out as a usable word. Would you like to mutune? That could be, would you like to unmute? So let me just start with just because I wanted to show that we do pick up on things. The gentleman, Colin Christmas, Managing Director of the Eagle Certification Group, he said, how do you see the role of international standards in relation to preparedness and response to COVID-19? And I just want to say I'm a super believer in the whole international standards process, or what some refer to as the ISO system. You will know that these ISOs are the rulings by the International Organization for Standardization. And there is ISO 45005, which is the general guidelines for safe working during the COVID-19 pandemic, which were actually very, very important for a number of factories and offices, and I believe are helpful. And because I think you need global standards when dealing with complex issues, just as David, I'm not saying this in WHO because I'm sure there's a WHO position on it, but as David, I think the ISO system is great. Thank you, Colin. To David Harron, who said, how can the distribution of COVID vaccine be expanded? The UK intends to give boosters, but what's going to happen about the rest of the world? Well, I just want to say that in my judgment, there is no case for universal boosters for people who've been doubly vaccinated in Europe or in the US or other places, Dave. But there is a case for additional vaccination being given to people who've got really damaged immune systems, who are immunocompromised, or people who are particularly vulnerable. That is okay, and that's, for example, what Ireland has just decided to do. I just discussed this with the Irish yesterday. So I think in my view, there's no case for universal boosters. But my colleague Ara Darzi in Imperial College, who's running a quite large serological study of people in the UK, believes that if one really wanted to try to use vaccine sparingly and make it available for the whole world, given the current supply shortage, what we ought to do is to test people's antibody levels, and then only if they are lower than a particular threshold, go ahead and immunize them. Now, the difficulty with this approach is that there's never a direct correlation between protection and antibody production. And so I discussed it with WHO experts on the issue, and they said they're not yet ready to recommend this process. But I think that with a bit of a collective effort and goodwill, we could reach a point where there was quite a careful study done of people's immune status, and then the decision to immunize would depend on whether or not they had low levels of antibodies to COVID in their bloodstream. It's doable. And so let's just wait and see, Dave, whether or not this kind of approach that is a bit more conditional is workable. I think when people are racing to vaccinate millions of people in big rush, this kind of titrated vaccination is a bit difficult. But personally, I think it's a possibility. The second thing I wanted to talk about was whether or not it's reasonable to argue that if you took patent protection of these vaccines and said anybody who's got the capacity to manufacture can do so, and you made it a transferable license under the compulsory licensing process of the World Trade Organization, in theory, you could get much more vaccine made. But the unfortunate thing about that is that it's really hard to make these vaccines, and WHO, if they're going to authorize a vaccine for use, doesn't just say whether or not the vaccine is useful as a molecule, it also studies the way in which the vaccine is manufactured, and it insists on making certain that vaccine manufacturing plants are good enough to be given a certificate of good manufacturing. So Dave, I think there are ways to increase the extent to which the vaccine can spread. There are ways by testing people's immune status. There are possibly ways by compulsory licensing. And some people are even looking at reducing the dose and giving it differently. But it's difficult, and we just don't have the level of global cooperation to really make that work. I'm going to now, I'm tuning in now to some of your comments. Christina says, I'd be keen to hear your perspective on today's announcement on the positive results of the Merck pill that is being considered as a possible therapy for COVID. It's called, it's got difficult to pronounce, but we'll find it easy later, molnupiravir, and would it be useful? So it's Merck, the drug company, that said on Friday that it's got good results from this pill, that's today, and it said that it's cut the risk of hospitalization or death in half when given to high-risk people early in their infections. I mean, it's not brilliant, but it's not bad. And personally, I find it great that this is likely to be something that can be taken forward. And just to repeat a point that Catherine and I have both made in different settings, you know, what matters for poor people is being able, firstly, to access low-cost, easy-to-use diagnostics that don't require a lot of electricity, and secondly, to access treatment so that they can get better quickly when they get sick and obviously avoid high medical costs and the possibility of death. That's what is needed. An equitable approach to this disease would prioritize diagnostics and treatment. And so I look at this information about molnupiravir, and I must say I'm quite excited about it. But I hate getting my hopes up on the basis of press releases. What matters is that there is a proper observational study, or even if it can be done, a proper randomized controlled therapeutic trial. And that WHO is equipped to do it. So, I mean, I haven't spoken to WHO friends, but I find that a real possibility. Beat Meyer says, what about the numbers in China? Well, there's most definitely quite a lot of COVID in China at the moment. I'm not surprised. I mean, China has basically tried to keep their country as free of COVID as possible ever since Wuhan. And they've done it through really effective testing, tracing of contacts and isolating. And they've also done a fair amount of immunization, and they've got high levels of population information. So, I mean, it's pretty good. But the fact is, there's a lot of susceptible people, and the current data from WHO from China is 125,000 confirmed cases with nearly 6,000 deaths. Current daily cases are at about 44. I mean, China is doing remarkably effectively at keeping the numbers down, and it's hard work. I mean, it requires constant effort by everybody. So, I would say, I mean, it's not bad. And if we look at other countries that started very strongly, like Vietnam, like Thailand, like Taiwan, New Zealand, they're all working pretty hard to keep their numbers down. But it's really hard, given the amount of COVID that's around in the world at the moment. It's really hard to open up your economy, face all sorts of problems of imported cases, if you're a country that's been keeping your numbers low. And by the way, I'm going to say to everybody, keep the numbers down. Don't just let it go and let the numbers come up and end up with a lot of cases. It may feel good, and you may think, oh yeah, great, you know, it's bravado. But think of the amount of long COVID. Think of the amount of virus you're going to have in the community. Think of the amount of opportunities for mutation. I don't personally think that's the way to go, though I know that doesn't necessarily lead me into the Hall of Fame in some of the countries which are more relaxed about transmission. And David Harron again, I answered your question, sorry. Ad Spikers, who I mentioned just now, he asked me to stress a little bit about what came out in the UN Food Systems Summit, and I'll just say it again. A simple way to summarise the points made by presidents, prime ministers and ministers at the summit was that food systems are imperiled by 3 C's: COVID-19, climate change and conflict. And I mean, I just hope that we all recognise that COVID's not going away anytime soon. It's sticking around. It's going to go on causing problems. There will be surges coming up in the winter. It won't be as bad as they've been some of this summer. But, you know, we all need to recognise that this degree of illness from such a dangerous virus is going to be damaging for our world as a whole for many months, even years to come. So Jo Nichols is talking about vaccination. She's talking about particularly resistance to vaccination. And what does this all mean? And I thought that it might be quite useful just in a few minutes just to talk about your point and do it in a way, if you like, that you can also perhaps speak about it in a way that others might find interesting. I then like to go to hold you for a bit and give you a chance to talk, and then we'll see how we get on, if that's okay. And Dave, you've got your hand up, so I'm going to stick to the sequence as I said. Jo Nichols, Holly Weaver, Dave Harron. Jo.
Okay, thank you. So we've been thinking a lot about how to get people back into offices safely, how to allow people inside buildings for meetings and that kind of thing, and looking at whether you can have a requirement for vaccination. Obviously, it's really difficult when it's still emergency use. It might get easier when everything is properly licensed. But even so, we've encountered quite a few people who feel that they are probably safe because they've had COVID already, their families had COVID, they're not worried about spreading it within the family. And therefore they don't like the idea of having to be vaccinated in order to go to the office. So particularly when people are thinking about becoming pregnant, they know that everyone's saying it's safe and it is making a difference, that there's that reassurance. But also, if you feel that you're not really at risk, I think a lot of people are still thinking, well, there's not really that 10 years evidence that we would like to see yet. So I don't want to feel forced into doing this. And nobody wants to force people into doing it, but it makes it hard to persuade people as well. So I think that's certainly one of the things I've been thinking a lot about recently.
Thanks a lot. Joe, two things really. One, I think there's quite a lot of asymptomatic COVID in Kenya, based on my own reading of the law. I think that means that there'll be quite a lot of people who are probably pretty immune, and I can quite understand somebody who's had COVID and it's been tested using PCR. I can understand them saying, why should I not? And that's where Darcy's approach that I was mentioning from Imperial is so important. I mean, he says that's a way you can test the response in people who've been immunised, and that in a way should enable you to avoid having to vaccinate them. Firstly, because why vaccinate people who don't need it if they're already antibody positive? And secondly, it saves some vaccine. So thank you, Joe, for making that point. Let's hold on to that. Dave Harron, please.
Yes, David. We're talking about a lot of people who are anti-vaccination anyway. What about people who might be convinced that it's a bad thing to go in for this booster situation? How could we guarantee that we would, if we started a movement to stop people being boosted, that vaccine would get to the right people in the world?
I do think that we're reaching a point where politicians in a number of Western countries are starting to listen. I'm just not sure that we're there yet. If I do get any contact with the relevant type of decision maker in the UK, Dave, I'll ask, is there any way in which people who voluntarily decide not to be boosted can be able to be reassured that the vaccine that they have saved will be available through COVAX for somebody in another place? I just don't know, Dave, how we'll get that, but it's the kind of thing that we need to start talking seriously to political leaders about, because they do need to know that there is an interest on the part of their constituents for a different kind of logic.
Yeah.
Dave, let's keep talking. You know how to, and it's quite important. Do you want to speak again?
No.
But thanks for joining. It's nice to see you again. Twice. I'd like to move to Holly Wheeler. Holly, actually we haven't heard from you for a bit, and I just think it'd be great around negotiations between COVID and poverty, what different forms that's taking, and what are the implications for governance, not just in the UK, but actually anywhere in the world. Holly.
Thanks, David. It's lovely to see you all. It's been a very busy few months as the UK it's trying to get back to some normality, but there are tremendous sort of evidences emerging in public health and in other bits of the public system and third sector that are just showing up the massive gap that you're talking about that is also evident around the world. So the referral rates to kind of for cancer, for any disease, they are much better for anybody who's already very wealthy or well off, shall we say, than they are for the poorest areas. And waiting lists are the same. They're much longer for the poorest areas. There's also issues around things like employment and education outcomes. So the people who have just left education in the poorest areas are not finding employment in the same way as more well-off areas. And the uptake of preventative measures like screening and other sorts of vaccinations are lower in the poorest areas. And dangerous, like concerning things like uses of food banks are still continuing to be very high, and also taking out temporary loans is going up again, which are usually early warning signs here. The things that I'm noticing in terms of action and behaviour is that on a very local kind of micro scale in neighbourhoods, people are going to try and do much more preventative work, and local authorities, local health services are starting to think about ways of redressing the balance and thinking about different ways of prioritising waiting lists to redress some of those issues. That is quite a politically tricky manoeuvre, shall we say, and that there's debates and conversations about how to do that. I think the most savvy leaders that I see, and I don't mean necessarily formal leaders in terms of positional roles, but those who have got influence, are starting to talk about how do you keep this difference and disparity alive so that we can have a proper dialogue, so that it becomes easier for politicians to be able to talk about it and make difficult decisions. Because the more the public is aware of the difference and why it's unfair, the easier it is for them to make decisions that previously they wouldn't have been able to make. And I've seen, as well as the waiting list, the other thing that I've seen, which I think is really interesting, is a focus on women. So a couple of councils that I know have set up specific kind of governance to look at how decisions are being made and their impact on particularly women in the poorest areas. Because again, unsurprisingly, it's showing up that women are the most impacted. So I'm quite fascinated by the way in which you guys have used the food systems as a lens into inequity, and how it's showing up about our interdependence, and how we need to all think about the same thing, and how everybody loves food. It's a way of creating a bond. So I'd really like to hear more about how that work's developing and any lessons that you guys are learning, because I think it'd be really useful for all of us.
Very, very much indeed for picking up how we got so fascinated by food as a way to enter into lives and livelihoods. I see Breeder here from Concern. I think it's Breeder. I can only see the very top of your head. I didn't know whether you wanted to say anything at this point. Half a minute. Just, I haven't seen you here before, and it's lovely to welcome you.
Well, thanks, David. Yes, I work with Concern Worldwide, based in Dublin, Ireland. I hear you on RTE National Radio a lot, and talking to my colleagues in Irish Aid, updating us. So I'm leading the health and HIV response globally. Yesterday, in fact, we were discussing the learnings marking 40 years of HIV to inform the COVID response. Hopefully, when we get through the COVID pandemic, it will re-inform to accelerate the disruption to services in terms of testing, treatment, care and support. Sadly, I'm expecting a surge in 2022, both in Ireland and in the countries working globally. So just interested to listen in. Thanks for your contributions.
And thank you for coming, and welcome anytime. We do it every 2 weeks at the moment. John Atkinson, sort of a valete from you, if you like.
I just wanted to try and respond quickly to something Holly said. So what have we learned from the food stuff? And I think it applies equally here. And I'll take it to quite a high level. Be humble, be curious, keep connecting, and you keep learning. And that way you make more and more sense of what's going on, because inequity is everywhere. It impacts widely across people's lives, and national figures and national numbers just don't tell the story of what's happening. So be humble, be curious, keep connecting, and we'll keep learning.
Say something about the energy that comes out of that process.
Well, I mean, I think anyone who's been connected to the food systems dialogues has just seen it happen, is that when you do that, you're acting in a way that liberates and not controls. And so much of what we try to do is to control what people do rather than liberate them to do the things that they really want to. When you do that, you access all the energy that they have, and all the drive and all the passion and all the enthusiasm and all the motivation. And so if we think of what we're doing as trying to liberate people rather than control them, we get into a really quite interesting space.
And that's been our experience with the dialogues. It's been brilliant, and it still is. It doesn't seem to stop. We don't know the limits. It's like almost infinite. As Rebecca has written in the chat, and Rebecca's been with us on this journey for some years now, it's organic. It's weird to think of it a little bit like the universe. Catherine, please.
Just a couple things. One is we had a conversation earlier today about, and I think this is super interesting, about the fact that the food systems have also re-emphasized the locality, the super localness and community-basedness of solution finding. Systems are really big and really complicated, and the where problems get solved is really with communities, with individuals, with people, giving them agency, the opportunity to make change. And then, you know, that translates, I think, up. It's one of those things that's hard to imagine. However, I as much as we could go on forever, I want to remind you, David, it is 1831, and you said you were going to end sharpish. I don't want to be the timekeeper here, but I am going to mention it. And I'd love to see Jack's picture. I don't know if you want to bring that in. So
here's Jack's picture, and then we go to Tweed to close us down.
Amazing image there, Jack. Thank you so much for joining us. I'm particularly interested in the world, the planet at the bottom, saying feed me, very relevant to what we talked about today. So thank you for joining us, everyone. I'm putting into the chat the links. So the first link is to our newsletter. We send you a reminder before our next briefing in 2 weeks' time to join us, as well as our LinkedIn community chat. So feel free to join us there and continue these conversations in between each briefing. Thank you, everyone. And just a reminder, this recording will go on YouTube. So if you've got any concerns with that, feel free to write to me at tweet@foresd.info, and we can make sure that we edit out if you have taken the floor. Thank you, everyone. Take care.
Thank you for sparing
Thanks,
the time.
everybody.
Thank you for being part of this. Bye-bye to all. Bye.